Right now, we're going to take you live to an announcement by Premier Doug Ford and Health Minister Sylvia Jones. Let's listen in live.
And COVID-19 has placed extra demands on the healthcare system across the country. We continue to encourage all Ontarians to stay up to date with their vaccines, including getting your bivalent booster dose and your flu shot. We are also extending the very successful free rapid antigen test program in grocery stores and pharmacies across the province until June 30th, 2023. I also want to thank our grocery and pharmacy partners for stepping up to help us deliver this program for another winter season. In light of all of these pressures, the government remains focused on ensuring we are not only having enough healthcare workers to deal with the demands of today, but also preparing for the future. It is why we have invested in publicly funded healthcare at record levels. We have ramped up our strategies to bolster Ontario's health workforce by providing increased funding to recruit, retain, and train nurses and other healthcare staff. I'm pleased to announce that we are investing more than $9.4 million to support accelerated critical care nursing at Centennial College, Conestoga College, George Brown College, Laurentian University, Mohawk College, and St. Lawrence College. This funding will help register nurses who want to work in critical care upskill in areas like respiratory, palliative, and cardiac care. The government will also be paying for the tuition of these students, along with all college and hospital costs, including any associated costs related to backfilling their current position to ensure continuity of care. Today, we are also increasing funding to 3 key programs that hospitals use to bring on more healthcare workers. The Enhanced Extern Program, which allows students to work in hospitals in an unregulated capacity. The Supervised Practice Experience Program, which helps internationally educated nurses meet Ontario's licensing criteria faster. And finally, the Community Commitment Program for Nurses, which offers cash incentives for a 2-year commitment to work in an area of high need in Ontario. These incentives help reduce pressures on our hospitals while providing learning opportunities for healthcare workers who will be working in our system for years to come. This year, we will also announce we're breaking down barriers to help bring on more internationally educated nurses in our workforce. And I'm proud to say our plan is working. I know Premier Ford will have more to say on that in a moment. We are just getting started and will continue to work every single day on our plan to recruit, retain, and train the nurses of today and for generations to come. Thank you. Stay well, and I will now pass it over to Premier Ford.
That's great. Well, good morning, everyone, and thank you to the Deputy Premier, and thank you to Kevin and Harvey for once again welcoming us to the University Health Network. And I'm thrilled to be joined by Deputy Premier and Minister of Health, Sylvia Jones. She's been a true champion. We're so grateful to everyone here and across Ontario's health system for all their work caring for the people of this province, especially right now. As the Minister mentioned, as we respond to the annual flu season, the RSV, and the COVID-19, throughout the pandemic, the people working in our health system did incredible work under heavy pressure. Nurses, doctors, personal support workers, pharmacists, lab techs, and the list goes on. Each stepped up and continued to step up to provide excellent care. On behalf of all Ontarians, thank you. We rely on our healthcare workers so much, and we're doing whatever it takes to ensure they're supported. That includes expanding Ontario's health workforce. It includes the largest expansion of medical school spots in a decade. It includes giving personal support workers a permanent raise. And it includes hiring thousands of more nurses. While there's still a lot of work to do, early results are showing that we're making good progress. This week, Statistics Canada released new data. Between 2016 and 2021, the number of healthcare workers in Ontario grew by nearly 100,000. That's a 21.5% jump in new healthcare workers in just 5 years. And our own numbers tell a similar story. Between 2018 and 2021, Ontario added over 14,500 net new nurses. And while this year's numbers are still coming in, the College of Nurses of Ontario has confirmed 2022 as being a record year. Ontario has so far registered nearly 14,000 more nurses, with 1 month to go. This includes 6,300 internationally educated nurses who recently started working in Ontario, as our government broke down barriers and provided funding for examinations, certification, and registration. And friends, more reinforcements are on the way. Today in Ontario, nearly 30,000 students are enrolled in nursing programs at a college or university, with thousands more students enrolling each year. That's a pipeline of new talent that will be ready to care for our growing and aging population. And as we train, retain, and hire more nurses, we also want to ensure we take full advantage of their amazing skills and knowledge. That means providing new opportunities to learn and grow in their job. So today, we're providing $4.6 million to upskill nurses who want to work in critical care. These funds will provide nurses with free tuition to study here at Michener Institute and will cover all college and hospital costs, including backfilling to ensure continuity of care. By spring 2023, we expect close to 600 nurses will have completed their upskilling education. That is 600 more nurses ready to care for our most vulnerable in ICUs across Ontario, including our pediatric ICUs. It's all part of our plan to stay open, our plan to provide Ontario's
We've been listening
families
live to Premier
with the
Doug
best
Ford
care
and Health
possible.
Minister Christine
It's
Elliott
all
making a
hands on
healthcare
deck as we
announcement
use
saying that
every
they're going
tool
to
we
extend the
have to
free
get more
rapid
nurses
antigen test
working
program
in
at
Ontario
pharmacies and
right now.
grocers until
My
June
friends,
30th,
over the past 4
2023.
years,
Their
we've
plan
made a
to
lot of
recruit,
progress.
retain, and train
We've hired
nurses
thousands
includes
of new
additional
healthcare
investments,
workers. We've
$9.4
added
million
over
to accelerate
3,500
the
more
nursing
hospital
program in
beds,
colleges,
and we'll add
and also
another
at 3 key
3,000
programs
as we
that would
make
allow students to
historic
work in hospitals,
investments in hospital
expedite
construction.
international
And we're
nursing
building
certificates, and
60,000
also cash
new and
incentives to
upgraded
work in
long-term
areas of
care
high
beds
need.
for our seniors.
Right now,
This
10:22,
is a
sitting
good
at the
start,
freezing mark
but
in
we won't
Toronto,
stop
feeling
there.
more like
We will
-7. You're watching
continue to
Toronto's breaking
invest
news,
in support
CP24.
our
We'll have
healthcare
more news
workforce
straight ahead.
to
Please
serve
stay with us.
everyone in this province. We're putting your health first as we build a stronger
about this plan?
We'll take you
Yeah, I
back
can
live to
confirm
Premier
that,
Doug
but,
Ford and
again,
Health
we had very
Minister
strict
Sylvia Jones
criterias,
making a healthcare
that
announcement.
has
Looks
to
like
be
they're taking
close to an
questions from
existing
reporters. Let's listen in.
development. And we're just happy that we're going to hold these people accountable to start building attainable and affordable homes for the next generation. Folks, we have over 300,000 people that are showing up to Ontario and the Greater Toronto Area every single year. In 3 years, it's going to be close to 1 million people. In 10 years, it's going to be 3 million. And we have to still fill the gap with the existing backlog that we have of people not being able to afford a home for their families. And everyone wants their little white picket fence and the key to put their door to put to open up and call it their own. And that's our goal. We're going to work collaboratively with all 3 levels of government and make sure that people have attainable and affordable homes.
Hi, Premier. Rob Benzie at the Star.
Hi, Rob.
I wanted to ask you about the Auditor General's report, and specifically, what did you think about the auditor dispatching undercover operatives into Ontario casinos to try to detect money laundering? I gather the Ontario Provincial Police were not happy with her and her team for doing that. What do you think about that?
Yeah, thanks for that, Rob. First of all, I can't speak for the police, but I know I'm sure they wouldn't be happy, be it the OPP, local police, or RCMP. The Auditor General has to stay in her lane, and focus on where there's waste of money. You can't do a sting operation. You can't all of a sudden deputize yourself and think you're the Secret Service going around doing sting operations that failed, by the way, and they were caught. Now these poor folks that they hired are now banned from the casinos. So she needs to stay in her lane, focus on value for money, and I think she's had a problem doing that over the last little while.
So you sound a little like Premier Kathleen.
All right, Premier Doug Ford defending his More Homes Built Faster Act, as well as the Auditor General's report, which was released yesterday.